Hydrocodone/acetaminophen is a potent dual-action medication for severe pain, but its widespread use has placed it at the center of the American opioid epidemic. This medication presents two distinct biological threats. The opioid component, hydrocodone, can cause life-threatening respiratory failure. The second component, acetaminophen, can cause fatal liver damage if improperly managed. To start this protocol, you need your original prescription bottle, a full glass of water, and a complete inventory of any over-the-counter medications you currently have in your home. Because this drug carries a high risk for overdose and addiction, strictly managing your physical environment and the exact math of your dosage is the only way to recover safely. Step 1 is the physical administration. Swallow the pill whole with a full glass of water. If the medication upsets your stomach, you can take it with food or milk. With an extended release version, never chew, crush, or dissolve the tablet. Doing so breaks the time release mechanism, delivering a lethal dose instantaneously. Next, check your prescription label to identify the exact milligram count of acetaminophen in each pill. Most formulations contain either 300 or 325 milligrams per tablet. This chart tracks acetaminophen intake over a 24-hour window. The total climbs in 325 milligram increments toward a flashing red line, the 4,000 milligram daily limit. This limit often overshoots when adding standard over-the-counter cold, flu, or cough medicines. Those milligrams stack on top of your daily total, exceeding the safe threshold. Because crossing this threshold causes irreversible liver death, reading every medication label is a baseline requirement for safety. Now, you need to conduct a physical audit of your home environment. You must isolate this prescription from any other central nervous system depressants. This requires a total ban on alcohol consumption. Mixing hydrocodone with alcohol creates a synergy that depresses your respiratory center and can stop your breathing entirely. Clear away any benzodiazepines, prescription sleep aids, or unapproved allergy medications that cause drowsiness. These specific drug interactions multiply the opioid sedative effects, turning a standard dose into a fatal overdose. Moving on to physical side effects, look at how opioids affect the digestive tract. By binding to receptors in the gut, opioids slow down motility, making severe constipation a likely side effect. You need to treat hydration as a mandatory preventative step. Drink 6 to 8 full glasses of water daily, beginning with your first dose. Pair that water intake with specific dietary interventions. Increase your daily fiber intake and consult your doctor about using over-the-counter stool softeners. Beyond the digestive system, you will also experience the drug's neurological impact. Expect varying degrees of drowsiness, dizziness, and lightheadedness. Because of this, there is an absolute prohibition on driving or operating heavy machinery until you know exactly how your body metabolizes the drug. Anticipating and physically counteracting these side effects from day one prevents a pain management plan from devolving into a secondary medical crisis. Even with strict management, you must prepare for an emergency. Teach your family or roommates the specific, visible physical signs of an opioid overdose. Watch for an inability to wake. Look for dangerously slow breathing, pinpoint pupils, and cold, clammy skin. If they see these signs, the immediate protocol is to call 911 immediately and administer the first dose of the rescue medication, naloxone, if available. The follow-up protocol requires the responder to stay beside the patient. If respiratory failure returns, administer an additional dose of naloxone every 2 to 3 minutes. Hypoxia, brain death from a lack of oxygen, can occur in just minutes. Having people around you who can deploy naloxone is your ultimate fail-safe. To prevent anyone else from taking the medication, practice active storage. The bottle must be locked away, entirely out of sight, and strictly inaccessible. The moment your acute pain is resolved, your treatment is over. Leftover pills must be destroyed, ideally at an authorized pharmacy take-back program. If a take-back program isn't available, use the at-home disposal method. Mix remaining pills into a sealable bag with used wet coffee grounds. You can also use dirt or kitty litter as an alternative. Throw that sealed mixture into your household trash. Then, destroy all personal information on the original prescription bottle before throwing it away. Prompt total destruction of remaining medication eliminates the risk of accidental pediatric poisoning and cuts off a primary supply chain for prescription drug abuse. By following these steps, you have built a complete defensive posture. You are tracking your 4,000 milligram limit, you have cleared your home of interacting chemicals, and your household is prepared for an emergency. As you execute this plan, watch for 2 clinical warning thresholds. You must flag your doctor if you go 3 days without a bowel movement, or if the prescribed dose stops controlling your pain. If your pain does increase, you are strictly forbidden from ever self-adjusting your dose or taking extra pills. Any change to the frequency or amount requires your doctor's explicit approval. Safely using hydrocodone and acetaminophen requires the patient to act as a disciplined manager of their own clinical protocol.